Hey, what's going on, everybody? This is David Brooks, the Cadillac counselor, coming at you to tell you a little bit what's going on my mind. Today, what's going on my mind is depression and anxiety. Before I get into that, you always know I got to give a shout out to Hats in the Bell Fry. Always give them a shout out. This is my gray one. I like it because it got a little bit of pop in it. You know what I mean? Always love whenever you subscribe. It helps me. It keeps this thing moving because I know that the further this thing goes, I'm going to take criminogenics with me and we're going to scream it at the top of the roof. So that's just something that we just going to do together. All right. Forgot. Don't forget to comment. Always love to see you comment. Um, Keep it respectful for the YouTube community. During this time of the pandemic, I've noticed that people have been always talking about how depressed they are. They're talking about their anxiety, but I wanted to really explain to you what's going on. And I think that some of these doctors and therapists are misdiagnosing when it comes to anxiety and depression. And I'll explain why. So here we go. So I've been getting a lot of patients coming in and clients coming in that have been, I guess, going to their primary care physicians during this time of the pandemic. I've been looking at their referral paperwork and it comes back to me as either general anxiety or it comes back as clinical depression. By the time I get them into my office, I do the assessments. I'm starting to notice that it's not always clinically depressed, and but I'll explain why. In order for something to be a clinically depressed, you have to have a couple criterias, and I want to give you those criteria so that you can understand. So first of all, you have to it has to have at least five of the nine symptoms to be in place during within a 2 week period. A lot of times these people come in, it's I don't see enough of the five in a 2 week span. Now they might have had one here, one there, like they might have a depressed mood. You got to have some kind of diminished interest or pleasure, significant weight loss, slowing down the thoughts, reduction of physical movement, fatigue. What else? Fatigue, feelings of worthlessness, diminished ability to even think or concentrate, and then recurrence of thoughts of suicide. All right. Sometimes they have one or two of these that kind of pop up, but there's not enough in the 2 week period. And so I kind of wonder, like, how are they being diagnosed with depression? Let me explain to you anxiety also. So anxiety is normally what they consider general anxiety diagnosis. In order to have that, you have to say that this person have some type of anxiety or worry, and it's about various topics, events, and activities. But normally, it doesn't last more. It's more than not. It's less than 6 months at a time. So now you got to understand during this pandemic, we are literally going into almost a year. So what's going on? So let's keep talking about the anxiety. So when it comes to anxiety, it also says that the worry is experienced as a very challenging to control. The anxiety or worry are accompanied with at least three of the following physical or cognitive symptoms. So it's edginess, tired very easily, have impaired concentration, irritability, muscle aches and soreness, and difficulties to sleeping. This is what general anxiety is. This is what I believe. I believe that there's another diagnosis out there that would fit better with what we're going through. But it's mainly for children and adolescents, but it fits very well right now. And it's called adjustment disorder. Now, adjustment disorder normally is, like I said, found in children, but I will read to you exactly what the diagnosis in the DSM-5 says. It says having an emotional or behavioral symptoms within 3 months of a specific stressor or occurrence in a person's life. They're experiencing more stress than would normally be expected in a response to stressful life events, which is affecting their relationships, school, or work. And then the last one, symptoms are not the result of another mental health diagnosis or a part of normal grieving. So listen to me. I think and I believe, and this is my clinical mind and judgment, and this is the other therapists out there, give me your opinion because I would love to know. A lot of people just don't have enough coping skills in place right now during the COVID. I've noticed that a lot of people have been coming to me for anger. A lot of people have been coming to me for drinking, and sometimes the drinking really picked up during the COVID, and it's not really considered dependence. It's more abuse because it's in a situation. And so for me, when I see people going to their primary care physicians to be diagnosed, especially if they have alcoholism or some type of substance that plays in a part, I would very much ask you to go see someone who particularly prescribes mental health medications along with understanding the substance abuse side. Because if you go to your primary, yes, some of the same medications can be given to you that would still be given to you by a psychiatrist that works in this particular field, but also you will get the other counseling that goes with it. You need to learn coping skills. You need to learn how to manage your life under the terms of COVID. Yes, we have a lot of political stuff going on. Yes, we have a lot of medical issues going on. The public safety is being questioned right now. And I believe that a lot of people are fitting the mode or criteria for adjustment disorder more than they are with general anxiety or clinical depression. And the thing about adjustment disorder is it gives you a couple ways to look at the symptoms and the signs that make this diagnosis unique. Adjustment disorder can be with depressed mood, and you can diagnose it with anxiety alone, or you can diagnose adjustment disorder with a mix of anxiety and depressive disorder mood. It can even be diagnosed with disturbance of conduct, so it's more of a behavioral issue. It can even be mixed with a mix of emotion and conduct, or it could be unspecified. All I'm asking is that you guys take a really look at, especially diagnosis, and then people who are going out to get diagnoses. Make sure that you ask them more questions because the DSM-5 allows an adjustment that says that this person is just not adjusting well with being isolated, with the COVID, with the quarantining. And I'm noticing that when people come in and they start to talk and they start to get an explanation of how to cope with their life, most of the people that I see don't even need the medication. It's because they just didn't have a cognitive plan of how to handle all of their free time and a lot of the things that they deal with from day to day. We got to kind of calm some of this diagnosing down because we don't want to leave people thinking that they are clinically depressed. And I'm going to tell you another thing. People are prescribing way too many benzos, are sometimes hurting people more than it's helping people. So really make sure that you are getting the right diagnoses, and therapists make sure that you are kind of looking a little broader for diagnosis. And I know that adjustment is mainly for adolescents, moving schools or some type of event that they can't handle well. But I believe that this would better fit in adjustment sometime unless it persists for even longer. And then we can kind of go back into a discussion about diagnoses. Hey, it's David Brooks, it's the Cadillac counselor, always telling you something that's on my mind. Take it easy. Bye.